Hello, and welcome to the first in a series of interviews for the clinical liver disease. CLD is an official digital learning resource of the AASLD. I'm Lisa Foreman, an associate editor for CLD, and I'm here today with Dr. Gary Davis to discuss the demographics of hepatitis C today. Gary, thank you for joining us.
Thanks, Lisa.
Gary, currently what populations are at risk for hepatitis C?
Well, it's generally said that those at risk are those who have parenteral exposure to blood. So those would be IV drug users and those who receive transfusions or pooled transfusion factors prior to 1990 or so. In fact, most of those at risk are the baby boomers, and that's about 70 to 75% of those with chronic hepatitis C.
And what are some challenges in identifying patients with hepatitis C?
Well, that's a real challenge. About 75% of those who are infected with hepatitis C don't even know it. And risk-based screening in identifying those who admit that they have these risk factors has not been very successful in identifying those. And there's an interest in moving towards age-based screening so that we can pick up the majority of those infected.
And what is the impact of hepatitis C?
Well, it has a growing impact. In 1997, about $5.5 billion in healthcare costs in this country, not counting the indirect costs of work lost and loss of years of life. But that's thought to have doubled in the last 10 years and will increase even further. The proportion of patients with cirrhosis has increased manyfold from back in 1990 when this virus was identified, and over the next 10 years or so, it's going to increase to about 50% of those infected.
So early detection and subsequent treatment are therefore important strategies to decrease the burden of hepatitis C. What do you think the impact is of hepatitis therapy?
Well, the impact of hepatitis therapy could be significant. Currently, it's not because very few of those infected are diagnosed and even fewer of those are being treated. That's due to a number of things. I would say mainly the effect of interferon, the side effects of that, and misunderstanding about some of the side effects of that, contraindications to interferon treatment. So until we get away from interferon and perhaps get interferon-free regimens, I don't think the proportion of people we're going to treat is going to increase significantly. Perhaps identifying more cases will do that. But if we could treat half of those infected, we could decrease the complications of liver disease by a third, which would be huge.
Well, thank you, Gary. And on behalf of the editorial team for CLD and all of us at the AASLD, thank you for joining us. To access the rest of the interviews for this issue of CLD, addressing hepatitis C, and to claim CME credit for participating in this activity, please visit www.cldlearning.com. Thank you again.